I was diagnosed with breast cancer when I was 31 years old. Prior to that time, I had been a fitness instructor. I was working for Gold's Gym. I taught an abs class. I had abs of steel. And I had a 5-year-old and a 7-year-old, so my kids were now going into school, and I was going to get a dog and go to Disneyland. Because that's what you do with a family of 4, right? They have all the good packages for families of 4. So I started to, go through this life thinking everything was great. We had just moved into a brand new home. It was like the dream home where we were going to raise our small family. This was at the end of 2006. I started having this feeling that I needed to get pregnant. And I fought the feeling, and maybe you know that feeling when you see the little babies and you want to just like go up and hug them and like squeeze them because you're like, oh, I want a baby. I just started getting really baby hungry. And I just fought that, and I fought that because I had abs of steel. Right? You know what happens when you get pregnant. You don't no longer have abs of steel. So I had worked so hard, I thought, no, I'm not going to get pregnant. I've got my 7-year-old. We really will get a dog. It will be fine. Well, I fought this feeling probably for about 4, 5, 6 months, and my husband came to me and said, Ginger, I really feel like we need to have another child. Now, if a guy says that to you, right? So I said, okay, we will get pregnant right away, and actually we did. We got pregnant super quick. And because of my abs of steel, I decided that I wouldn't be telling my family that I was pregnant. It would be the surprise. And just so you know, I have 6 sisters and 1 brother, very large family. So as this pregnancy starts to develop, I noticed that there is something forming on my areola that's like this reddish brownish color, and it hurt when you pushed on it. And so it's kind of weird, and I thought, well, that's kind of crazy, but your boobs change when you get pregnant, right? So I didn't think anything of it because I was a fitness instructor. I was in the best shape of my life. Everything was almost like too perfect for me at that time. And as my pregnancy continued, I got to be about 4 months pregnant. I went into the doctor and I said, I've got this really weird thing. And so he checked it out. And he said, wow, that is really strange. I have never seen anything like that. I don't know what that is. So why don't we watch that and see what it does. We'll just, keep an eye on it. Well, 5 months comes along, and yes, this little red weird thing has now started to grow. And he says, we probably better get that out of you just to make sure we can figure out what this is. So I thought, okay, no big deal. We'll just, get it out, and it's no big deal, right? You know how you kind of look at hindsight? And you go, oh, now that I know things that I didn't know then, and you go, oh. So anyway, fast forward to about 5 months pregnant, and we go in and we have the biopsy. They have to put me under anesthesia, and so they wanted to do this surgery really quick because they didn't want the baby to have to be under, with the heart rates and things that they were monitoring. So the surgery gets done, and he says, okay, we'll come back in how many days, ladies? 3 days, right? It's those 3 days you have to wait for your results. So we go home, and I'm like, okay, well, this is great, no big deal. I was a little apprehensive because I wanted to know what it was, but I had no inclination that it would be anything wrong because I was so healthy and I was so young. So fast forward those 3 days, and it actually ends up that 3rd day landed on Halloween. I send my cute little kids off to school to enjoy their Halloween festivities, and me and my husband set off for the hospital. We go into the room, sit down, and my wonderful surgeon, Dr. Carabine, comes in and says, I can't believe I have to tell you this, but you have breast cancer. It was that moment that everything shifted for me. Not only was I a young mother, not only was I living in my perfect world, but I hadn't told any of my family that I was pregnant. You see, my abs of steel were so good that at 5 months pregnant, you couldn't tell, which is amazing, right? But now I had this dilemma. How do you tell your family that you're pregnant and you have breast cancer? So that's what I had to do. Halloween night. My family was all at my mom's for our annual Halloween haunt. Kids are eating chili and chips. We're just sitting around before trick-or-treating begins. And I have to say, I have some good news, and I have some bad news. What do you want to hear first? Tell us what's the good news. What's the good news? I'm pregnant. Oh, we thought so! You can't wait forever! We thought you were pregnant! So, what's the bad news? And many of you might have experienced this. But the first time you have to squeak out those words, I have breast cancer. It changes everything. It changes everything. Now, you could have heard a pin drop, and that's even with all the little cousins. Nobody spoke. And that, my friends, is what shifted everything for me. Cancer became the catalyst that gave me, actually, purpose. It helped define who I am, and also what can be achieved when we as survivors put our minds to accomplish something. Now, I decided that I had to figure out a way to cope with what was happening to me. I am typically a very upbeat person. I typically try to stay upbeat because the opposite is not very fun. And I went into that infusion room for the first time and I saw these amazing people, just like you, who had lives, who had stories, who had family, and none of us wanted to be there. We were all stuck in a room that we didn't want to have to go to because we knew what was going to happen to us when we came out. Now, I had my newborn, those heavy carriers, skipping right in. Hi, here for chemo, because I have no idea what it's going to do to me. And I sit down and they plug me in. I was eating M&Ms at the time when they plugged me in. Can I tell you, I do not eat M&Ms anymore. Because on the Pirates of the Caribbean, if you've seen that movie where Balboa says that the food turned to ash in his mouth, oh yeah. Like it was like I just threw up in my mouth. And I was eating chocolate. Like chocolate is my favorite. And I was eating chocolate. So anyway, I went home after that first event and I said, okay, God, we've got to do something. Because there is no way that I'm going to be able to be a mom, to be happy, and to go through this experience. So what can we do? So my first idea I had was to play bingo. Little chemo bingo. And I set out and I made me a bingo set, and I still have it today to remind me of what I do. I took my bingo set in before my next appointment. I said, Dr. Hansen, I'm going to play bingo. And he looked at me, oh, Ginger, you are so cute. He didn't really say that, but I know he was thinking it. But he said, nobody's going to want to hear you call bingo. And I thought, what are you kidding me? I just spent 10 hours making a bingo set. But after they plugged me in for my second dose, and you know what I'm talking about, most of you, I knew that no one was going to want to hear the words bingo. So I went back to God and I said, what is the plan B? Because plan A got shot down, so what are we going to do? And that became that on my good days in between treatments, I would go out and I totally pulled the cancer card. I said, look, I don't have hair, I don't have boobs, I got this newborn and these two kids, and I am not the worst one in that infusion room. So you will be working with me. Thank you. And then as the prizes came in, I would take them with me, stand up, because obviously you can tell I have no shy factor. I would do a little halftime entertainment with the patients, and then I would sing everyone a song. And this is how it goes. You can never know the good if you've never known the bad. You can never be happy if you've never been sad. You've got to taste the bitter so you can know the sweet. You've got to be hungry to be glad that you can eat. You've got to be sick to be grateful for your health. You've got to need money to appreciate wealth. There's got to be some problems to rise above. You've got to know lonely so that you can know love. It's called opposition, my friend. After singing, I would go around the room and we would take these little gifts, whatever it was, from candles to tool sets for the guys, and we would hand it to the patient or to their caregiver, and I would say, Happy Chemo. Now, I had no idea that that two-word combination is a complete oxymoron. They do not go together. Chemo is not happy. But that two-word combination changed people's lives. They started to talk. Where it was quiet before, people were sharing stories, there was laughter. And I didn't even realize what was happening until a lot of the nurses came up to me and said, you've got to come back, you've got to do this again. Did you see how it changed the room? Now, in saying all this, I don't want to come off as saying that I am so awesome because look at what I did. It's not that at all. What it is that when we choose to act and give kindness, even when we ourselves are facing one of the hardest journeys in life, that we will find that happiness will multiply as it is shared. Now, do you know that there is seriously a chemical reaction that happens in your brain whenever you do a kind act? It is proven scientifically that if you do a kind act of service for someone, your brain sends off all these positive endorphins. But get this, the person who's receiving the gift, their brain fires off all the positive endorphins. And anyone who sees the act of kindness, their brains fire off positive endorphins. So anytime you give a gift, whether it's a smile, whether it's a big hug of concern, whatever it might be, you're actually generating happiness. Okay? Now, I know that chemotherapy is not happy. And I don't want you to think that I was just this Pollyanna happy girl all the time, because there was days when they would plug me in and I would do Happy Chemo, and then I would sit in my chair and say, do not talk to me, because I am not happy today. Because it is that bad. So I want you to understand that I am not floating around here, like my kids say, eating rainbows and pooping butterflies. And I have been accused of wearing rose-colored glasses. But let me tell you something about wearing rose-colored glasses. You can still see. You can still see. Doesn't make everything go away, but it sure does make it nicer to look at.